Good afternoon and welcome to today's webinar hosted by the Health and Places Initiative, an interdisciplinary group between Harvard University's Graduate School of Design and the Harvard T.H. Chan School of Public Health. The HAPPY Project, which is what we call it for short, investigates how to create healthier cities in the future with a specific emphasis on China. My name's Emily Salomon, and I'm a research associate with the Graduate School of Design, and I'll be moderating today's webinar and assisting with any technical questions you may have. I'll also be presenting some materials on the health assessment tools this afternoon. Our webinar is titled Planning and Design Health Assessment Tools, and is the last in a series of 5 webinars that featured research conducted by experts involved in the HAPPY Project. This webinar is being recorded and will be made available on our website afterwards. A PDF file of the slides will also be posted online. Now, before we go any further, I want to quickly review the functionality of Adobe Connect, which is what we're using to broadcast this presentation in order to maximize your viewing experience. Your active participation is important throughout today's session. Right now, I have everyone on mute to avoid background noises, but if you have any problems, please click on the audio icon, which is a green button located on the top left of your screen to test your speakers and adjust the volume. You'll see a box on the right-hand side of your screen with the label Q&A, and this is the question and answers pod. If you have any questions during our presentation, please type your question into the lower box of this pod. When it's submitted, it will go directly to the speakers and I, and only we will see the questions that you've asked. I'll be monitoring the questions as they come in, and what we'll do is after our presentations, we'll read the questions out loud and then verbally respond so that everyone can hear the questions and then hear our responses to them. Throughout the presentation, you also have access to the chat functionality on the top right of your screen, and you can use that chat pod to let us know if you have any technical difficulties or questions or want to get in touch with us about anything. So please interact, submit your questions, and we'll try to get to as many as we can. Quickly, I'd like to introduce the speakers on this webinar who all work at the Harvard Graduate School of Design before you hear directly from us. You can read the full biographies for all 3 of us on our website. Our first speaker is Dr. Ann Forsyth, who's a professor of urban planning and a principal investigator of the Health and Places Initiative. Laura Smead is a research associate in urban planning for the Health and Places Initiative also. With a master's degree in urban planning and psychology, Laura has specialized knowledge on health, aging, climate change, and sustainable urban planning. And as mentioned earlier, I'm Emily Salomon, and I'm also a research associate on the HAPPY Project, focused on communications. My background is in community development and planning, and I have over 10 years experience working on issues connecting land use planning, transportation, affordable housing, and health together. So without further ado, I'd like to turn it over to Dr. Forsyth.
Thanks, Emily. The Health and Places Initiative brings together people from Harvard's design and public health schools to create an evidence-based approach to making healthy places. We have a particular focus at the scale of the neighborhood or town down to the block. As you can see from the diagram of the project, it has a lot of components in the areas of research, education, tools, guidelines, publications, and events. But today we're focusing on the area in dark blue in the center of the chart, on the health assessments aimed at planners and others interested in assessing the health of existing places and proposals for changes. In order to create these health assessments, we started by reviewing the literature on a variety of topics connecting health and place. We then wrote a series of accessible summaries we called research briefs. During the first 6 months of the project, our team reviewed hundreds of studies on the topics you see here on the slide, and then synthesized this information into the briefs, which are now available online. As you can see here, the focus on environmental exposures like air and water pollution, how places can help people connect to the resources they need for healthy living, how they can support healthy behaviors like healthy eating, and also key concerns of vulnerable groups, particularly older people. I'm going through these briefs because the research contained in them served as a foundation for the sorts of questions asked and the range of topics covered in the health assessment tools. Now, health impact assessment is now a pretty wide practice in the United States and has even more history elsewhere. There are many terrific introductions to health impact assessments online in printed publications and in conferences. And the resources part of the HAPPY website has links to a number of these, and that's what's pictured here. However, a decade ago, HIA was emerging as a wide-scale practice, and at that time I was involved with a number of others to create a set of health impact assessment tools specifically targeted at planners. That was the Design for Health suite of HIA tools that were released to the public in 2007. In creating the tools for the HAPPY project, we reviewed the range of health assessment tools and reports now available, but we could also draw on this personal experience of the lessons involved in developing this earlier HIA suite. For example, I'd actually been quite surprised by the popularity of a lengthy comprehensive planning review checklist that we really didn't intend initially to be part of the suite, but rather was more of an internal document to help us review plans. People seem to like having a lot of very specific questions. I'd also wanted to make a more flexible workshop tool than the Design for Health one that reflected the sort of actual practice that I'd had conducting health impact assessment workshops. And it is also to make the screening tool applicable to a wide variety of projects. Of course, with so much prior work, why did we bother to get involved in creating a new set of tools? It really is good practice in many fields to use tools that have already been developed and tested, and I'm a very strong believer in that. However, we saw some gaps that were not being filled. First, these HAPPY tools are oriented towards planners and other people working with the built environment. They provide more basic knowledge about health, in part through their links to the research briefs, than is typical in HIAs. But they also assume that users know the basics of things like how to run a public process, and that isn't often assumed in HIAs. They focus on a scale of work, the block and the neighborhood, that planners often deal with as well. Most health impact assessments are also designed to look prospectively at proposals. But from our experience working in planning, we also wanted these to be applicable to existing places. One example, is evaluating an existing place before deciding to do a new plan. That's a common desire amongst planners. And in addition, another thing that we wanted to add to existing HIAs was to make them more international than many other tools. And we wanted to make them easier to use with how-to guides. So it's a suite of tools that gets at different parts of the planning process in the end, because it's hard to have one tool that can be used in all parts. So tool one is a typical approach to screen a project or place to see if it's worth doing more assessment, but aimed at planning specific types of questions. And it also has a component where users can scope out what are likely to be important issues. Tool 2 is a very long checklist in both paper and Excel versions. And what it is really a way of diagnosing what might be working well and what may need help in either a project or an existing place. And finally, Tool 3 is a workshop based on the tried and true rapid assessment model that brings together local people and health and planning experts to engage with a project or place. We feel we've made some improvements in terms of helping people prepare background materials and also in suggesting some more flexible formats for the actual event. Finally, while the health assessments are completed, we're also engaged in testing and refining the tools by getting reviews from experts and also testing them out on real neighborhoods and urban design prototypes. Those revised tools will be available online later in 2015. So now I'm going to pass the mic to Emily, who's going to talk about the first of the three assessment tools we developed.
Thank you, Anne. So the first suite in our suite of health assessment tools is the Screening Survey of Health in Place, and the acronym for that is SHIP. This covers the first two steps of most health assessments, which is screening and scoping. While it may seem as if health is always an important concern, resources can be limited, and the screening portion of the tool helps decide if it's worth conducting a more elaborate health assessment of a place, proposal, or plan, and if the costs of doing a larger assessment are outweighed by its benefits. The scoping components of this tool help identify, in a very preliminary way, which health issues are likely to be of concern, which then can be delved into more deeply when conducting other portions of the assessment. This tool is designed primarily for the development and redevelopment at a site and neighborhood scale in urban settings, but that said, it's a flexible tool that can be used at a larger scale or even at building level for building level assessments if it's modified correctly. The Screening Survey of Health in Place tool has four main parts, which should be approached as an individual steps in a series, since the responses in part 1 determine whether to move on to part 2 and so forth. Part 1 of SHIP helps you collect necessary data to conduct health assessments. The questions in this part ask about the type of project, plan, or place being reviewed, the existing area of that place, the number of people living there, the demographics of the population that might be affected. If several of the questions in this part are unknown, it's best to go back and gather more information before delving further into the process. Part 2 is a screening portion of SHIP that helps identify broadly whether there are sufficient reasons for conducting a health assessment. That is, are there concerns about negative health impacts of the plan or proposal or place? Are there vulnerable population groups at risk because of the plan? Would conducting this type of a self-assessment strengthen ties between or among stakeholder groups? The responses, as you can see on this slide, have numbers associated to them, and they can be added up. And based on this score, we suggest whether to proceed onto the next section or not. Move on. Part 3 of SHIP helps determine if the project, plan, or place is significant enough to assess. So sample questions that we include in this section are, is this a good use of resources? Or does the scale of this project warrant an assessment? Or is there enough acknowledged to support the health assessment? So keep in mind, not every item needs to be a yes in order to move forward in the process. Like part 2, there's a score associated with each response. But this score is really just a rough attempt to quantify importance. If it's deemed significant, you can then proceed to the next section for the scoping checklist. And part 4 covers some basic questions on health and place topics to quickly analyze the local resources and potential health impacts inherent in the context of the project. The questions in this section are focused on qualities of the built environment and exposures, health-related behaviors and outcomes, and connectedness. These topics stem from the HAPPY research briefs that Dr. Forsyth described earlier. This section, unlike part 2 and 3, doesn't create a user score, but we recommend that any areas that are checked yes or don't know be investigated further using other tools in the health assessment suites. And Dr. Forsyth mentioned earlier that each of the tools have a how-to guide that can be accompanied, that you could use as you go through each of the tools. And that provides information on the types of resources that you might need to respond to each question and where you might find those resources. So that's a quick overview of the Screening Survey for Health in Place. And I'll pass it over to Laura Smead, who will explain the second in the suite of tools.
Thanks, Emily. So the second health assessment tool is a more detailed diagnostic tool to help identify more specifically areas of strength and potential problems in the place or plan. The tool could be used in a couple stages of the health assessment process, either as a more detailed scoping tool or to help frame the assessment stage of the health assessment itself. As previously mentioned, the questions in this tool are focused on more urban environments at the neighborhood scale, but with modification, it could be adapted for rural environments or larger or smaller scales. And we really do encourage you to modify the tool to suit your needs. There are two formats the tool comes in. The HOC tool can be used either as a printable paper version, just PDF, or as a modifiable Excel version. Like Tool 1, each question asks you to identify whether a particular feature is present, sort of present, not present, or not applicable. Unlike Tool 1, there's no scoring aspect to Tool 2. It's simply a way to identify which aspects of the plan or place are particularly positive or negative for health. One really important feature is the comments section. Comments line allows users to reflect on dimensions of the project or place that may be particularly positive or negative, or to make notes about topics to investigate further. It's recommended that the data source, page number, or web link used to answer the question be documented in the comment column for easy reference. This is especially important if you're working on this document with other people. So on the screen, you can see how both questions 2.1 and 2.2 are answered with a sort of. So the comments section is important to distinguish the two. Question 2.2 reads, does the land use plan incorporate neighborhood commercial and/or mixed use development to encourage transportation-related walking and social interaction? And the response for this site, sort of sample site, describes that, well, the site is zoned only for residential and does not have any plans to mix in commercial or mixed use at that location. It has some flexibility in terms of density and is walkable to the town center. So that's just a sample for you. And here's a screenshot of the Excel version of the tool. In a digital form, the Excel HOC makes adapting and sharing the tool really convenient. The spreadsheet is color-coded to show which questions are most important for health versus which ones are just generally good to do. So on the screen here, you only see the blue color, which is important for health, but there's also green color for a smaller subset of questions that are just sort of best practice good to do. It's also conditionally formatted so that certain responses to each question are color-coded to visually flag responses that require more attention. So here you can see that anything with a sort of or a no response is flagged to yellow or red, and all the questions are written so that a no response is worse for health and a yes response is better. The Health Opportunity Checklist contains 7 parts. Unlike Tool 1, which divided its questions across health topics like disasters or air quality, this tool divides questions across dimensions of the urban built environment and larger policy contexts. So dividing it up like this also facilitates easier sharing across city departments. You might think of public works or planning, transportation, or water departments. Each part can stand alone, or they can be combined to create a more comprehensive assessment. And not every question is going to be relevant to every project, but each one gets at an important topic and are designed to encourage users to identify additional connections between health and place. So now we'll dive into each sort of section very briefly. The questions you see on the screen are actual examples of a question that are in the questionnaire. So part 1, the general questions, are going to cover connections between the place or plan and health content, implementation plans, or health-related organizations. So a sample question is there any explicit mention of human health in the proposal or plan? Part 2, the layout, site layout questions address urban form, infrastructure, access, and buffers. For example, are potentially contaminating industrial sites, such as refineries, waste sites, and nuclear power plants separated from residential neighborhoods by 2 to 3 kilometers. Part 3, the law, policy, and activities questions involve the existing legal and policy framework anything from pollution mitigation, climate change, disasters, poverty, food policy, transportation, you name it. So, for example, if the area has high numbers of pedestrians, cyclists, or traffic accidents, or maybe no pedestrian or cyclist infrastructure at all, or roadways that are high speed and high volume, are there policies and programs to mitigate this? You might think of speed limits or safe routes to school programs. Public spaces. These questions can range from access to neighborhood parks and community resources all the way to regional conservation efforts. So, for example, do residents have access to a variety of aesthetically pleasing green outdoor spaces like parks, wilderness areas, and landscape areas? The building questions cover a variety of exterior and interior elements at the building scale, things like setbacks, landscaping and noise, and disaster mitigation, to technologies, indoor toxics and air quality, sanitation, safety, or universal design. For example, are setbacks on high-rise buildings used to prevent a canyon effect in urban environments? Part 6, transportation. Those questions address access, connectivity, and safety. A sample question is regular transit service available or planned for all residential and employment areas, preferably within 800 meters of all residential areas? And finally, there's water system questions relating to infrastructure, sanitation, protection plans, monitoring, and cleanup. A sample question is there a regional watershed protection plan? For example, buffer zones, stormwater management, water quality management. So, like all 3 tools, there is a how-to guide that accompanies the tool with instructions and details about each question and where to get the information. So now I'll turn it back over to Emily again, who will go over Tool 3, the Happy Health Assessment Workshop.
Thanks, Laura. The third tool in the suite is the half-day health assessment workshop that Dr. Forsyth mentioned briefly in the beginning. A workshop is recommended if one has the time, resources, and capacity to organize an event that brings people together to discuss the health impacts of a plan, proposal, or existing area. Convening people in a workshop format can be beneficial because it generates interest and energy around a project. It allows different stakeholders to interact with one another, and it has a start and end date, which can be helpful in order to meet a deadline. There are 4 basic phases to planning and implementing a health assessment workshop. Each of the boxes on this slide corresponds to one of the 4 phases. First, the box, which is the box on the top left, is starting the process and generally relies on screening and scoping, which we've talked about with the first and second tool. The box below represents the steps in getting information together. This is a time and research intensive process, which can set the stage for the third step, which is running the workshop and bringing folks together. And following the workshop is summarizing the results and communicating those results to decision makers and other relevant parties. As this slide shows, within each of these phases, there are a number of sub-steps required to make sure the event is a success, and I'll talk through those sub-steps in a little bit more detail. So starting the process entails some screening and scoping elements introduced earlier to identify the plan, proposal, or existing place being reviewed, and to decide if it's worth conducting a more elaborate health assessment. Once the first 2 steps are achieved, there are a number of other tasks involved to plan for the actual workshop. One is designating staff that can dedicate time to the tasks and logistics associated with coordinating the workshop. And the other subset is organizing a steering committee together. And I'm going to spend just a minute talking through the steering committee since that's such an important part of workshop planning. The steering committee is usually composed of community members, civic leaders, planners, public health practitioners, developers, and others that are involved with the plan or place. The steering committee can be set up especially for this health assessment as a way to build coalition to implement changes about health, or it could build off an existing working group. There is a lot of flexibility in how this is done and approached. The roles of the steering committee members can also vary. They can oversee preparation of a background report, which I'll cover on the next slide. They can serve as a workshop facilitator at the actual event. They can help gather input from stakeholders about the project or place being assessed. They can help set the workshop agenda or contribute to the final report. It really all depends on the skill set and interest that the steering committee members bring to the table. Next is getting information together, which is primarily about collecting information and data about the plan, proposal, or place in order to prepare a background report, which is read by participants before attending the workshop. The background report helps frame the entire health assessment and the potential health impacts of the project or place. Assembling this background report can be a time-consuming process because it has so many different detailed sections about the project and the workshop planning process. Many of the sections of the background report are listed on this slide, including providing a rationale for conducting the workshop, a section on the details of the proposal, plan, or place, the scope of the project, an outline of the potential health impacts it might have, a profile of the area, and information on existing plans or other health impact assessments that have taken place in adjacent areas or are related to the project. And then there are sections about the workshop planning process, with the goal to be as transparent as possible about who's involved, the stakeholders that have provided feedback and preliminary discussions, and the findings from the screening and scoping stages. And so I'd say it's difficult to generalize because there's so much flexibility in conducting a workshop, but that a lot of the background reports that I've looked at from previous health impact assessments range anywhere from 10 to 50 pages. And I'm saying this just to emphasize that it does require a lot of time, research, and collaboration with steering committee members and other folks familiar with the proposal or plan or place to assemble this background report, but it is a critical document to proceed the workshop. And the third part is actually convening the workshop, running the workshop, and bringing folks together, and I'd argue that this is probably the most fun in the whole process. The workshop is carefully facilitated to bring people together, to share their experiences and concerns, and in order for participants to learn from each other and prioritize actions. The workshop should be guided by an interactive agenda that features specific activities to engage participants and spur discussion. Again, the steering committee can be an invaluable part of setting the agenda. Some common workshop activities include large and small group discussions, SWOT analyses, which cover the strengths, weaknesses, opportunities, and threats of the proposal or plan or place, and prioritizing activities where participants can rank issues or areas of concern. Our how-to guide offers sample agendas and activities that can be included in the workshop. I think I mentioned this before, but our health assessment workshop tool is based on a half-day format, but can be customized to meet the needs of the people planning the events. And following the workshop is synthesizing and communicating the results. Results from the event can be summarized and written in a final report that can be disseminated to the public, especially those who might be able to influence the plan, proposal, or place. The how-to guide presents a sample outline for the final report, so I recommend that you check that out. But at the very least, it should include a compelling summary of the workshop, explain the process as well as the outcomes, and prioritize recommendations and implementation actions. The images that we've included on this slide are a snapshot from an executive summary of a final report used in a health impact assessment looking at the reuse of a former airbase in Cambridgeshire, England. And we've included it because it's a good example of an informative and concise report that's accessible to a wide audience, but especially to someone like a policymaker that might be short on time to read a larger document. There are other steps in wrapping up a workshop, but their completion largely depends on the nature of the project assessed. Implementation is one of these steps. It may or may not be possible to implement the results from the health assessment, though again, disseminating the results from the workshop to the right decision makers could help make those recommended changes come to fruition. Implementing the results is an area where the steering committee could be a key resource. And the last step is an evaluation of the health assessment process. And realistically, few people do this because it can be difficult to accomplish, but it is considered a best practice. So this isn't about evaluating the workshop per se, but evaluating whether the whole process influenced health outcomes. And that means that it needs to be done well after the health assessment workshop occurred. So that's a summary of the 3 tools. This is a screenshot of our website where you can actually download the tools and use them yourself. So the URL at the top of the page is research.gsd.harvard.edu/happy. It's a long URL, but that's our website. And if you go to the home page, you can see a set of images that slide through on the home page, and some of those are buttons to different sections of the website, including a button that goes directly to the tools. But you can also go down to our research menu, go to tools, and then you'll see another drop-down menu that takes you to the health assessment tools. And there you can get all 3 of the tools and the how-to guides that we've just gone through. So now I'm going to turn it back to Dr. Forsythe, who will talk more about the application of these tools on the ground.
Thank you, Emily. Obviously, these tools cover a wide range of areas. So how can they help planning practitioners and others in similar fields? Well, first of all, they're individually and as a whole a great way to increase awareness about how planning decisions affect health. And this can be important in developing allies in related fields and departments. And they can also create allies in the wider community as people see the relevance of planning to health. More specifically, they can help people in a particular place identify things to keep, things to change, and also trade-offs they might have to make, again, improving decision making. But those are some initial ideas about what makes these useful in practice. I thought that in this last part, we're going to engage in a little conversation about what is most useful about this suite of tools. And as you heard, I think one of the key aspects is they're focused on planning and can be easily used in different parts of the planning process. But Laura, what about you?
Well, I think another thing that makes the suite of tools special is that it's based on a pretty extensive international literature review. And that research informed, as we mentioned, the scoping portion of Tool 1 and Tool 2, the Health Opportunities Checklist. And the health assessment how-to guides for Tool 1 and Tool 2, as we mentioned, they identify which research briefs and health topics each question refers to. And since the research briefs are available online, users of these tools can peruse, the background research briefs or dive as deep as they want into the original sources as cited in the research briefs. Emily?
Sure. I'd like to add that the tools are designed to be flexible and not prescriptive. They're intended to be used for different types of projects or for existing places, and they can be customized accordingly. So with Tools 1 and 2, the Screening Survey of Health in Place and the Health Opportunities Checklist, there are many health assessment questions, but we recognize that they aren't going to be universally applicable, and they can be picked and choose from based on the relevance of the project.
Oh, actually, and finally, what I'd like about them is they're actually not an evaluation of whether a place or a project is good or bad, but they are meant to have a real diagnostic role. Their whole focus is on helping people keep the strengths of a place and identify and improve areas that have weaknesses in terms of health. They also, to do this, use different kinds of knowledge, more technical expertise, but also local knowledge, and that can lead to better planning. I think we could all say more, but it's time for questions, and so I'm going to hand the mic over to Emily for that component.
Great. Thanks, Anne and Laura. If you haven't submitted any questions, I want to encourage you to do so. You can do that by writing in your question on the bottom right pod that has the label Q&A and hitting submit. That will go directly to us. So please send those in if you have any in the next few minutes. But it does look like we have a couple questions already. So I'll read that off and we can respond to them. The first question is, what were some of the challenges in developing these tools for an international audience? Do you want to take a stab at that?
Sure,
Laura?
I'll take a stab at that. One of the things that I can think of off the top of my head was that there's some limitation in the research, into actually how international the research itself is. So some of the health areas, like you might think of the relationship between physical activity and the built environment, a lot of that has been done in the Western world, so to speak, the US, Australia. I guess Australia's more Oceania, but Europe, it's not a lot of Asia yet. So that was a limitation. So where there was evidence, we really sought it out from as international as we could and included it, but that was definitely, sort of a challenge to make it as inclusive as we could.
There are also different problems in different parts of the world. For instance, indoor air quality from burning biofuels is more of an issue in some countries where they're burning wood or cow dung than in other countries where that's not used. In addition, when doing the how-to guides, we were really sensitive to what kind of data might be available. So trying to talk about how to complete the health assessments using available data in particular places. In addition, we really tried to think through the kinds of typical places that might be in other middle and high income countries, testing it against those locations.
Great, we have a question that came in. For assessing the impacts of human health and well-being,
Of disasters.
For assessing the impacts of disasters on human health and well-being, the focus is trying to understand how negative impacts to the environment. I'm sorry, let me just make this a little bit bigger so we can see the question better. Okay. The focus is in trying to understand how negative impacts to the environment due to disasters such as an oil spill impact human health. Do you have recommendations on which tools to use and which data on human health are most important to collect? And that's a great question, so thanks for asking that.
Yeah, so the most impact I think that planners can have for disasters is really on the prevention angle. And so there you're going to be doing things like a vulnerability assessment. You're going to have to know what kind of disasters you're vulnerable to in your particular area, and then you're going to have to know things about where your vulnerable people are and where your infrastructure is and how all those intersect. So there's going to be a lot of sort of, I can imagine, geographic, GIS, data.
But in terms of these current tools, they're aimed at evaluating existing projects and places, not really evaluating in a disaster circumstance, but it's in the circumstance of wanting to do long-term planning or evaluating someone's kind of long-term proposal for change. It intersects with disasters in that it identifies potential vulnerabilities that then can be investigated with specialized vulnerability assessment tools. So really, this is a diagnostic tool that can start to say, is this place vulnerable to potential technological disasters, disasters from climate-related sources, geophysical sources, and it would then allow you to go on and do more. It's not going to be the whole process because it's really focused on this long-range planning approach.
Yeah, so in Tool 1, there is a section specifically on disasters, and then in Tool 2, those sort of questions are integrated across different dimensions of the different genres that we've divided up, but they are identified in sort of a column there if it pertains to disasters as well.
And then we have a research brief on disasters that deals with how this is intersecting with planning, which is a little different to the way it would intersect with, say, disaster relief.
Right, and the brief on climate change also kind of touches on some of that elements too.
Yes. Yeah. I think we have a third question that's come in, Emily.
Yeah. So the question is, you describe that the scoping tool questions are based on research you've conducted. How can we gauge the strength of the research and the evidence that's presented in some of those questions? And so thanks for that question. It's a really good one. We do break out in the in the second tool, the health opportunity checklist, we break down the questions into what's should be done and what's good to do. And that's our way of presenting evidence that's more rooted in the research and others that would be just considered best practices and wouldn't do any harm if you were to implement those types of changes.
Yeah, and I would just add that if there's a particular question in the checklist, for example, that you find surprising or you want more information about, you can look to see what the research brief keyword is, and all those research briefs also break things down into what we know, what we don't know, what's up in the air, to get some sense of where that is coming from.
Yes, and so there is one issue, for instance, is the role of trees in air quality. And so that's been a very interesting area to investigate. They can certainly help some aspects of air in the long term, but actually may not filter particulates as well as many people believe, and could also produce pollen. So you'll find that kind of background material, that's sort of the nuanced view of the literature in the background in the research briefs.
Mm-hmm.
Great. Another question just came in. It reads, it sounds like your HIA tools focus on how the built environment can be improved with the hope that it would impact population health.
Yeah.
Is the Health in Places initiative or any other health assessment tool focused on what a population's current health issues are and improving the built environment to resolve those issues? For example, if a neighborhood is severely impacted by diabetes, is there a way to evaluate the built environment to improve or prevent other diabetes cases from developing?
Because these health assessment tools are designed to integrate with the planning process, they start with place, because the initiator of a planning process is either going to be a proposal for altering the place, or an idea that you might want to do a new plan. It would be, however, possible to start with a health concern, and certainly and then work backwards to thinking about what to do about a place. Right.
So in the tool 3, for example, the background report talks a lot about knowing your demographics, and part of gathering, I would say, part of gathering your background on your place will be knowing what your health issues might be in that place. Some areas are going to have higher rates of obesity, some areas are going to have higher rates of smoking, some areas are going to have, what have you.
And in fact, if I were in that situation, I would start with a workshop, even if at a small scale, so to help identify potential issues, allies, and opportunities for actually changing the environment. Because you want to have actually policy relevant or planning relevant kind of findings coming out. If there's no way you can change the built environment, no one's interested in doing it, there's no money, then that's not the way you're going to improve diabetes. So it would be good to start with a workshop that helps identify the range of health issues beyond the one that may have sort of bubbled up as the initiator of the process, and that then can bring together people to sort of investigate, even if in a preliminary way, how you might want, where the opportunities are for changing the place. And then you might go through some of the other checklists and so on and come back to a workshop again. It could be, as Emily said, those workshops can be sort of flexible, and it could be smaller, and it could be internal to an organization. It doesn't have to be 50 people, it could be 10 people. And that might be a very good way to figure out which planning opportunities there are given the topic that you're interested in.
Great. Yeah. Another question came in. It reads, how much does the amount of natural environment exposure and the quality of the environment that people are experiencing factor into the assessment of health? And this goes beyond the typical understanding of trees being good for shade and air quality, for example. It's more about people's mental health and physical health and the potential relationship between the amount of natural ecosystems they experience. How much does nature exposure factor into your health assessments? Thanks for that great question.
Yeah, well, actually quite a lot. And if we had to think of a low-hanging fruit in terms of improving health, it's the sort of landscape thing. Doesn't have to be a completely undisturbed ecosystem, but certainly even views of green would help both mental well-being, stress reduction, cognitive function, which are not all mental health, they go beyond that. It can also help with water quality, some aspects of air quality if it's not creating pollen, and so on. And that's actually a major theme in a number of the research briefs, including mental health, water quality, air quality, and perhaps some aspects of physical activity, particularly related to recreation.
And I think kind of the main theme is to really have a variety, of different environments, because we know that it affects health, but there's not necessarily clear, it seems very sort of cultural, right, on exactly what kinds of aesthetics and types kind of people tend to like and use more. Really depends on the people.
Yes, and it varies by person and by their situation. A number of the sort of early studies on this and sort of aging and green space were done in Tokyo, where there's not in places where there wasn't a lot of green space, and so any exposure really improved health outcomes. And so that has to be placed in context in somewhere where it's already a leafy sort of suburban location. Increasing a little bit may not have those same outcomes. So we tried to be sensitive to the sort of there are different age group responses to environments, different cultural responses of people who live in different kinds of physical environments. But that said, I was going to give a lecture at some stage, and I asked the staff what I should say is the things we should do for health, and nature and landscape was one of the top three.
Yeah, because you can think of, preserving ecosystems is a major, on a wide scale, that's a major thing you can do for water quality, disaster management, and all that kind of thing. And then at a local scale, if you're going to put green space, you get a lot of bang for your buck if you put, say, a healing garden next to a hospital, or getting more creative with school landscaping around there and things like that. You can think of strategic locations that improve that for health.
Yeah, and I would just add, I really encourage you to take a look at our tools, especially tool 1 and 2, because as you peruse the questions, you'll see that we really do address a lot of these issues related to the natural environment and how it relates to health.
And I could throw out a plug for the guidelines book too, that we're writing.
Yeah.
Right? So that we're writing a book on guidelines for health in place, and with a number of sort of specific actions, and the sort of natural environments and ecosystems is a major component that runs through that book as well.
Yeah, both in terms of short-term health effects, like the sort of immediate health effect of looking at a natural scene, versus the long-term benefits to health of sort of larger scale sort of ecosystem preservation and so on.
And a follow-up question to that is about the guidelines book and when that will be available.
Oh, that'll be a long time. At least a year. We'll get it done before that, but these things take a long time to come out.
But that's a great question. Thank you. I want to thank you for submitting those questions. They're really good. We'll break. I think that's it for now, but we really appreciate your interest in this presentation and in the tools that we've developed. And I want to remind you that a recording of this webinar will be available on our website this afternoon. The link, you can see that on your screen, the URL. It's research.gsd.harvard.edu/happy. It's a long one. But the recordings of the other webinars from this series are also available online, so I would encourage you to view those at your convenience. And if you have any questions, please get in touch. We encourage your questions and feedback and hope to hear from you. So thanks again.
Thanks.
Thanks.